So this is our Automorpho mattress. It is a alternating pressure relief mattress suitable for anybody that needs pressure care. That would be maybe somebody that's lying for about 15 hours or so, and that maybe would be immobile. For pressure sore areas from grade 1 to grade 4, this is an ideal mattress for prevention of pressure sores, and also for the treatment of pressure areas and maybe broken red skin areas. This comes with 18 cells. As you can see, they all inflate alternately. So one will inflate and the other one will deflate, which creates a ripple effect, which is very good for pressure relief. 18 cells, they can be taken out, easily repaired, easily cleaned, and it's covered with a stretchable, wipeable, very easy to clean mattress, which can be used by multiple users if necessary. On the base of this mattress, it's foam, so you get some pressure relief, and often people worry that if there was ever a power cut and the air cells were not working, you still would have some pressure relief in the foam. And also there is an electric valve system that allows for some of the air to be held, so in the event of a power cut you would still get full pressure relief. The foam is at the bottom. You have your cells here, they alternate. You have, when you're installing the mattress, it fits on top of your profile bed. It's important that it's fitted top to toe first. So on your mattress you'll see the feet and the arrow to show you how to fit it the right way around, which is very important. When you get your mattress, it'll be quite compact, it'll be rolled, and it'll come with instructions. It'll come with the hoses to connect to your battery. Again, quite lightweight, easy to be delivered and easy to be set up. On your battery controls, you have 3 different types of therapy care modes for pressure care. You have dynamic, static, and you also have care. For your dynamic, that's your alternating standard cells filling with air each second one alternately, usually 9 to 12 minutes. Again, it depends on the individual and the nursing care need and clinical need, so that can be made individualised if necessary. For your static mode, this is very good for clients that doesn't sit well with the alternating mode. They might not find that comfortable, and they mightn't sleep well with it. So you can put static on, and the person can sink into the actual cells a little bit more, and it envelops the body, which can be more relaxing and better for sleep for clients that don't do well on alternating mode. For nursing care, you can fill up all the cells with air to make the mattress firm. It allows you to dress the person, to turn them more easily, to sit them at the edge of the bed if they're able to, without it being wobbly. So care mode is very good for nursing care of an individual person. As you can hear, it's actually quite this particular motor, which is great for sleep and for the person. Sometimes they can be very loud and they are difficult to sleep in if they're loud. The reason being sometimes around that is with these cells, they're made of polyurethane. They're usually made of nylon sometimes. The polyurethane is quite soft, so it does allow for less vibration and less noise. So it's very comfortable to lie in and also quieter. For nursing care as well, it's important that you have a CPR control button. This can be taken out or in, if necessary, to somebody that is in needs some defibrillation or needs to their cardiac care seen to. This can be taken out, and within 20 seconds it can deflate fully so that nursing care can work on the person. So when you plug in your mattress, it can take a little bit of time just for the cells to inflate. It is very sensitive to the change in positions as well in your bed. So if the person is sitting upright, there is an automatic sensitivity that the air will disperse more to the hip area or your sacral area, pelvic area. So when you're sitting upright, you're not going to bottom out, that the mattress will sense that and will adjust itself accordingly. There's an automatic adjusted pressure calculation there. And as I said before, you can have all the cells filled up. So they fill up in a few minutes. So you can see in the Automorph that it is made of 18 air cells that can inflate, and if they do deflate or whatever or get punctured, they can be replaced quite easily. They can also be cleaned very easily. It's zippable, a very wipeable material. And underneath you have, as I mentioned, the foam mattress, which gives it a little bit more stability, sturdiness and comfort for the overlay mattress. This zips in place to keep it secure. You also have, alongside the mattress, a button seam to ensure that the lead is secure in place and it's not trailing. Very important, I suppose, that you don't have anyone trailing on leads, tripping, but also for hoisting, that it's not along the floor and gets in the legs of the hoist. So that is very compact. You also get some strapping additionally to secure the mattress fully in place. The last 4 cells, as I mentioned, is unique to this mattress. They can be deflated. You have a little circular gauge here that can be turned on and off. You can switch it off to deflate fully, the deflation time. And if somebody's got heel sores, sores on their feet, and you want them just suspended on air, no contact with any part of the mattress, that can easily be organised with this particular type of Automorpho Plus mattress.